chronic miasm. He want to say some message here. It is true. Next. Next. And this is the whole treatment of the patient. The fifth aphorism is very important, where he says about the constitution. Useful to the physician in assisting him to cure or the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of the patient, chronic disease, to enable him to discover the fundamental cause, which is generally due to a chronic miasm. Here we have to apply our mind. What he want to say that there is, we have to pick up the etiology, that is causation of the disease, and moreover developmental part. In these investigations, the ascertainable physical constitution of the patient, whatever the totality is taken, if the patient fixed with a particular constant, prescribe him. That is the constitution here. And especially when the disease is chronic, his moral, intellectual character, his occupation, mode of living, habits, so his social, domestic relations, his age, sexual function, etc. are to be taken into consideration. That's what we probe our mind to, the mental part and the other part, the peculiar nature of the disease. Each prescription is an individualistic. Next, please. He also insisted in the aphorism number 206. Next. And coming to that, there is a controversy about miasm, whether they are bacterial or some dyscrasia or predisposition or some altered manifestation of the disease. My understanding is nothing but it is an altered manifestation. For take example of chikungunya. It is an infection. That's what Hahnemann says in the fifth aphorism. There is a causation. Then it develops some toxic influence, that is imprinted protein in our body, which changes the C-reactive protein to rise, and some changes in that. And finally, what causes? After some time, the reactive arthritis. One of the thing we inspire, even the VDRL positive patients. And here, we know that cell is the functional unit of our body. Each and every cell has its own miasm here. And it is attributed with the physical, chemical, microorganisms, metabolic and inheritance. Physically, it is involved with the cold and heat, and chemically, the drugs, and even exposure to the other area. And microorganisms are nothing but the inflammatory. And here the metabolic. Metabolic is both inherited and the changes within the metabolism, and inheritance also involved here. Basically, the cell has to involve all these things. So, this changes sensitize the cell. Any changes that should have these basics of understanding the physical, chemical, microorganism, infection or metabolic changes or any inheritance. Next, please. And here, Hahnemann says that nothing but a SORA is a sensitization, not like, because we picked up that gonococcal virus and syphilitic virus, so that many think that it is a bacterial origin. But he want to, at the time of Hahnemann, there is no development of science. There is no cellular theory. And he says something, picked up that theory changes. What he says, that SORA is nothing but the sensitization of the cell. That is the inflammation or some hypersensitivity reaction of the cell. And later on, it develops into psychotic. That is nothing but the deviation, excess we can say. And that is the proliferation, like a wart. And later, syphilis, nothing but the gangrene or necrosis, dissection. It is a highly deviated from the normal routine of the cellular, basic cell.